Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new here, please make sure you do subscribe. If you are a regular viewer that has not yet subscribed, what are you waiting for? In the very least, give this video a thumbs up, like this video, comment below if this resonates with you, or chime in and offer your feedback, offer your guidance. Usually on Fridays, I do Q&A. That's when you viewers email me your questions and I select randomly about 4 questions and I answer them. I decided to do something a little bit different with Q&As. Moving forward is instead of answering a whole set of 4, make Q&As very lengthy, to either dive deeper into one question or to do 1 or 2 or 3 questions. So for this Q&A, I have selected a question that I find really interesting. That not only is it an interesting question, but a lot of people tend to ask me this question a lot. And the challenges with this question is it's not a very clear-cut answer. It doesn't really have a one very specific answer. And this is why it warrants a discussion on its own accord. So the question that the viewer asked me is this: how can I really get the best out of my transitioning from male to female? So this is clearly focusing on trans feminine, gender affirming care, trans feminine transition paths, and we're going to zoom in on that as well today. So oftentimes when people ask me how can I get the best out of my transitioning, my question to them, and this is going to be my question to all of you who are asking yourself the same thing, is to ask yourselves what is best means to you. Now, I know that a lot of times when people are studying gender transition, they would rather be told how to get a very clear, specific blueprint, if you will, to follow, because that way you feel more in control, that way it takes all the guesswork out of it. But I found in my experience is that actually can be very detrimental to you, because that implies superimposing a cookie-cutting approach onto not only your own individuality, but also on your own individual history, as well as your own access of resources, your access to care, your access to finances, your personal goals, as well as your psychological makeup. I have found in transgender communities that a lot of people still have an assumption that to transition toward feminine end of a spectrum implies to go through everything and have everything down under the sun. The reality is that that is not true. And a lot of people feel or been told that you're not a trans woman enough, you're not a woman enough unless you do A, B, C, D, E, right? The most common one that I hear is you're not a trans woman, you should not be calling yourself a woman unless you have vaginoplasty. If you still have male genitals, you are not a woman. And so it's really important at the outset of gender transition to ask yourself, and this is what I do ask my clients when they ask me this, is, well, what is best means to you? When we start breaking down the best, oftentimes at the end of the best, there are goals. Each one of us has a goal. And you have your own goals. So the first thing is very important to outline what your goals of gender transition are. No matter how impossible they seem to you at the moment, no matter how grand they seem, it's very important to put them down on a piece of paper. Because without the goals, you won't know where you're going. Without the goals, you're just going to be doing things in a very hodgepodge approach. And so things are not going to be in alignment with your particular life circumstances. And it is incredibly important to have them aligned. What do I mean, have them aligned to circumstances? Well, if you find out that one of your goals is to get gender-affirming surgery, and you haven't explored pathways towards that goal, one of which means you either need to have a really great health insurance that's going to cover it, or partially covered, or have financial resources on the side, or be able to get access to financial resources to fund the surgery. The number of people that I work with that have had a goal to have a particular surgery, usually it is facial feminization for a lot of people, because again, our faces are our primary, faces are something that is very visible to the world. Faces are something that people very hyper focus on for if passing is your goal, for safety reasons or otherwise. And so I've seen a lot of people who really have their goal is facial feminization surgery, only to then find out once they started hormones and came out and started doing other things, is that, oh, I had no idea how expensive it is going to be, especially with a doctor I want to work with. Or I had no idea that in my country, the wait for FFS is that long. Or I had no idea my insurance, which I thought was great, does not cover the surgery. So having a very clear what is the best for me in the sense of goals is the first step. Once you have your goals, again, no matter how big they are, how grand they are, then what I encourage everybody to do is to work backwards from your goals. In other words, can you outline little steps that you can take that will lead you toward achievement of those goals? If your goal is, for example, I just want to feel better, I want to alleviate the distress of gender dysphoria, and I really want hormones to be able to do that, I'm hoping the feminizing hormones are going to do that, then that is your goal. How are you going to get into achieving that goal? Do you have a clinic close by? Are you in a country where, my God, the way to get approved for hormones, and yes, some countries you need an approval for hormones is several years. What are you going to do in the meantime? How are you going to cope with gender dysphoria? So working backwards is going to be very important, because everybody's goal is going to be different. Your goal might be to reduce distress. Somebody else's goal might be, I want to reduce distress and I want to start evolving into my authentic self. Somebody else's goal might be, I want to reduce distress, I want to start evolving into my authentic self. And here's the standard of my authentic self that I want to achieve. This is, again, I make this analogy to parallel to fitness all of the time, because it is so similar in terms of pathways. If you want to get on a better fitness regime, what is your goal? Any fitness trainer will ask you, what is your goal? Is your goal to lose weight? Is your goal to gain strength? Is your goal to tone up your body? Is your goal to gain weight? What is your overall goal? And the goals can overlap. And then how are you going to go about achieving those goals? When people say, when I talk to people about the best way to get the most, to get, like this way, to get the best out of my gender transition, I always say that apart from having a goal and steps outlined backwards on how you're going to achieve it, is to have very realistic expectations. What are your expectations are? A lot about gender transition happens actually in here. I know. A lot of times people think gender transition mostly happens externally, right? Our bodies are changing, you're going on hormones, the hormones are changing not only your secondary characteristics, but hormones are also changing how you feel about yourself. You start socially transitioning, you're coming out, people you start forming new relationships maybe. So a lot of external things. So we tend to conflate gender transition with external things. But a lot of, I would say, the success, in my opinion, of gender transition is highly dependent on your mindset. I would even argue that the mindset is one of the biggest factors in determining how well your gender transition is going to pan out. And after the mindset, I would say access to resources. By resources, I mean finances, insurance, gender affirming access care, all of those things that you are going to need or may want. Remember, gender transition is huge. Not everybody's going to want to go through physical alterations. But the mindset is really, really important. The reason why I'm such a strong believer that the mindset is the most important thing is because I have seen it all. I have seen people in a very, very, very detrimental financial positions. I have seen people with a lot of access to finances and access to resources. I have seen it all and in between. And I have learned that the mindset plays the biggest contributing factor because I had a personal client that was on Medicare. My heart just always, I take a sigh when I think about her. She also struggled with severe history of trauma. She struggled with severe other secondary mental health diagnosis. She was homeless. That's right, she was homeless. She would come into my office back in the day when I was taking insurance. She would come into my office and she would have a shopping cart with her belongings. She will come off of sleeping on a street. This individual I worked with, and what I learned from her is what a human mindset and resilience can do. In spite of all of her challenges, and she has been the most, I would say, the client that I had who was in the most dire circumstances, I don't think it can get any dire than being homeless and living on the streets. On top of that, struggling with all of the things she was struggling with. And on top of that, trying to resolve your sense of gender identity. She was finding a way to make her transition happen. Did it take her longer? Absolutely. Was she denied sometimes surgical care because she didn't have home, she didn't have post-op care? Yes. Did that stop her? No. Why? Because of how she chose. That's the control we all have. How you choose to make sense of your experiences. I equally seen clients, work with a lot of clients actually, that have unlimited funds under their sun. Unlimited funds, unlimited money. Let's say money is not an issue. It's not an issue. They can go to the best surgeon. They can have all of their surgical needs met in the next couple of months. And yet, they were so self-defeated. Nothing was good enough, or something was always an obstacle for them. Two different scenarios. And so I have learned from this client, this wonderful woman, that nothing is impossible. Will it take somebody longer? Yes. Is it going to come with hurdles and hardship? Absolutely. Did she do it? Yes. So mindset is going to be your biggest friend. Your biggest friend, and it's going to be your biggest cheerleader as well. Again, things happen to all of us. Things happen to you, things happen to me. A lot of things happen beyond our control. Things happen to this beautiful woman beyond her control. But guess what? Even though things happen and will continue to happen to all of us beyond our control, how we make sense of it, how we internalize those experiences, and what we choose to do once those things happen is within our control. So your mindset is going to be your best friend. So I would suggest to make the best out of your transition from male to female, start with your goals. Work your goals backwards to the very, very basic first step. Outline in detail as much as you can, either by yourself or with support with a therapist, how you're going to approach it given your circumstances. How are those steps fitting within your life frame? How are those steps fitting within your circumstances? And then start slowly going through the steps. A lot of times you'll find out that the plan you have created is going to have detours, is going to change over time, is going to shift as you go along. All of this is part of the process. Things are going to change. You're going to find out that some parts of your goals are going to change. You're going to find out that what you thought was the best for you has shifted. It's all about day in and day out. Paying attention what you feel today and where you're going tomorrow, and let that be your compass. Don't jump too far ahead or too far into the future. Be present with yourself, because things, when it comes to gender transition, do undoubtedly change. You are discovering things about yourself. The number of people I work with whose goal was to have a particular gender surgery, only in the process find out that I actually don't want that surgery, is tremendous. The number of people I worked with who thought that they're going to come out to maybe a whole list of people and then realize that they're going to keep it more private, they're going to keep it more to themselves. Again, things shift according to where you're at. So the best way that you can make the best thing out of your transition is to have a plan, to have a goal, to consider your circumstances, to consider your psychological makeup, to consider your overall life and how it's all fitting into you. Some of you have kids, some of you have partners, some of you are single, some of you, like this person, has other things you're struggling with. Some of you are struggling with finances, some of you have unlimited resources. How is all of that going to fit in? That's what I would recommend. Comment below, share what your thoughts are, how you approach your gender transition, and I will see you all next time. Goodbye.